everyone. I'm Dr. Aditya Patil and I welcome you all on behalf of Health and Wellness by Arya and for another wellness podcast. So today we have very special guest, Dr. Sam Sering. He is basically from Dharamshala and he has completed his schooling from Suja. After completing his schooling, he has completed his 12th from science background and he has cracked one of the toughest examinations for Sowa-Rigpa course in Mense Khang. So Mense Khang is a Tibetan Medical and Astroscience Institute. So there he completed his solid 6.5 years degree course, including 1 year of internship. And he then finally graduated in 2019 and started his job in Mense Khang as a clinical doctor. After that, he has worked in Delhi, Dehradun, Dharamshala, Lahore, Smiti, and he is currently working as Manipur branch of the clinic. So, welcome, Dr. Sam.
Namaste. Yes, welcome. Thank you for inviting.
So, I'll start with very basic question. A lot of people are not aware what exactly Sowa-Rigpa is. So, I'll tell a little bit of background. So, Sowa-Rigpa as a system of medicine has been identified by, recognized by Government of India, Ayush Ministry in recent years. And it has become immensely popular throughout the India and we can say in some neighboring countries as well. So, can you tell us a little bit about the history of Sowa-Rigpa? What exactly this Sowa-Rigpa is and what are the origins of Sowa-Rigpa?
Thank you, Dr. La, for inviting me today here. So, Sowa-Rigpa. Sowa-Rigpa literally means science of healing. This Sowa and Rigpa, these two words, is a Tibetan language, a Tibetan script, which means the science of healing. So the historical, it's very long history since from the starting of the 6 AD or in between 780 AD during the famous king of Tibet, and then the 8th century in between the Sowa-Rigpa is become very popular because the king that time is very religious person. So he invited some neighboring countries' physicians, especially from the India, from the Nepal, and even from the China. So invited all these physicians and they make a roundtable conference and his physician himself participate in that conference, and then after all they make one textbook, medical textbook, that is right now called the Yushi Tantra. We are studying that textbook still right now. So from that time, what it happens is it becomes very popular in neighboring country. The Sowa-Rigpa practitioner still existed in Himalayan regions, and then the Nepal also, and some part of the China also, and the Himalayan region of the India also. So it's right now very popular in India. So in Sowa-Rigpa system, in India right now the biggest one is Mense Khang. Mense Khang means Tibetan Medical and Astroscience Institute. His Holiness the 14th Dalai Lama re-established in India. Actually, 13th Dalai came in refugee in 1959. Then they started and again re-established in 1960. Since from that, more than 67 branches are in India.
Okay, sir. that was very good to know about the history and its origins. So, Dr. Sam, now you have been practicing Sowa-Rigpa for quite some time, and you must have had a very good experiences with the patients. And you yourself have witnessed the healing in the patients. So, can you share some of your experiences with the patients? How was it to be a practitioner of such ancient medicine?
Like as being a practitioner of like a Tibetan traditional medical system, so it's very unique way. In that kind of like way of diagnosing disease, way of treatment, it's very holistic way. Holistic in a sense, the way of like doctors behaving to the patients, the way of the medicine is formulating, all are in a very holistic way. Even like, for example, in medicine, what it happens is like all the herbs combined together, formulated together, and make a medicine. For example, if kidney medicine, for example, one kidney medicine added more than 30 different kind of herbs. What it does, like one herb helps for good for the kidney, but then other single herbs that affects the other part of the organ. Then what in our like formulations, what it does, like one herb, another herb is added in that, and then neutralize to reduce the side effects to the other part of the organs. So like in overall, what it does is like there is minimum, like zero side effect to the patient after taking the medicine. So like even the medicine is in a very holistic way. So what I feel right now is like even analyzing or giving the medicines, I have very proud that this patient, this disease can easily treat by Tibetan medicine. So even like I have crossed many like chronic diseases such as like the psychosomatic type, depressions and like nervous disorders, and then the post menopause syndrome, like gynecological, and then the other part of like backbones, and then the weakness of kidney. Overall, like this, we can like we have like trust for the medicines, and we are treating very well for that kind of thing.
So yeah, you are treated and managed various types of conditions and using Sowa-Rigpa itself. So there are a lot of similarities between Ayurveda and Sowa-Rigpa, but there are also some differences. So can you tell us what is the differentiating factor, or what are the key differences between Sowa-Rigpa and Ayurveda?
No, I'm not that much familiar in the Ayurvedic way of treatment. But I have like little bit knowledge about like three doshas, like for pitta, kapha. That same similar concepts that we used to taught in our in our medical texts also. So, but I didn't see whether that is mentioned in Ayurveda text or not. Like we mentioned like the root of the disease is from the cause of the disease is from the ignorance, and then like vata, with because of the generating the attachment, vata increases, and then the increase of hatred, that generates the pitta, and then the delusion and illusion, this kind of things that generates the vata, pitta, kapha. This kind of things that we used to teach in our text, medical text, that whether it is mentioned in Ayurveda system or not. And then other part is that even we used to check the pulse reading and the urine analysis and discussion with the patient, even reading the reports. All this may be similar, but we focus mainly more focus on the diet and lifestyles to the patients, especially lifestyles. We used to describe, we used to advise very detailed how to tackle your mind also. Mental status is very key, important part of like taking how to handle your lifestyle. Like this kind of things we used to mention to the patients. And for therapy point, I guess like there is big difference. Like we used to focus or for like copper cupping therapy, and then the medicinal bath, then the medicinal massage, and then the heat compression, and then this nowadays like gold needle therapy. That might be different from the Ayurveda point of view. We have like special like gold needle therapy. That's very effective also. And right now we have like surgery field, but like bloodletting, these things. But nowadays we are practicing this lace.
Okay. So just now you mentioned that like you give treatments via medicinal herbs like that are used in SowaRigpa, and there are some other methods also like surgery or acupressure. So can you tell us some other modes of treatment that are used in management of these diseases? Yes.
One thing I forgot to mention, the questions that you asked. Medicine might be different from the in composition might be like the different little bit. All the raw materials are mostly same. All the herbal plants mostly are same. But we used to make pills form. Mostly our medicine are pill forms. I can show you a later part also. Pill form, and some are in sachet form, and then some are in a liquid form, and then the sachet form. So this kind is maybe different from the Ayurveda point of view. And then in therapy, in like treatment, we have like first we have detailed mentioning about the diet and lifestyle also, and then in a therapy we have as I mentioned before, we have like medicinal bath. It's very good for like chronic disease, especially the arthritis type of thing. And then the medicinal massage, it's the condition massage. Wherever the problem is, we used to do massage also. And then the how to say, heat compression. Heat compression, it is the compression is mainly with the medicinal herbs that with the heat, and then used to do on the problem area with the compression. And then I had mentioned about the gold needles. Nowadays also, like we have even every doctor, they know how to do acupuncture also. It's also very good and effective for especially the paralyzed type, and also the bell palsy. And these things very good. Even like some like pain relieving, the acupuncture is also effective. And then also we have like nowadays like mostly have the plastic cupping. We have like tradition way, that is the copper cupping. Copper cupping is made up of copper, that is ball, and ball type of thing. We use fire in that, and then create the pressure and suck the pain area. That helps to release the muscle tension, improve the blood circulation. Copper itself has quality to suck up all the bad blood. That's very effective also.
Very nice, sir. And so there are a lot of physicians all over India right now who are practicing this system of medicine. So how can we know that, means like the medicines that are prescribed? So is it easily available throughout the India? That is one of the questions. How can people have access to this type of medicine? So can you please tell that where should we look for such physicians who are practicing Sowa-Rigpa?
In the introduction, I forgot to explain about the Mansikang. Mansikang is re-established in the Dalai Lama, re-established by His Holiness the 14th Dalai Lama in India. This Mansikang, the Sowa-Rigpa, institute is the oldest and largest and most reputable Sowa-Rigpa institute in India. Its main primary object is to preserve and promote, revive the traditional Tibetan medicine system. There is also extra practitioners there. So presently there are more than 67 branches all over the India. Mostly 5 branches are in Delhi, in the biggest city in Delhi. Also Mumbai, there are 2 branches. Bangalore, there are 2 branches. Even at the Karnataka state, in Hyderabad, over even Gujarat, Jaipur state. This detailed information we can provide in there. At nearest branch, you can available our medicines and herbal products as well. So, for male consultations, you can do by visiting the clinic also. For male consultation, you can contact to our branch head at Dharamsala. So, medicine is available in everywhere in India.
Yes, sir. So it was very nice meeting you, Dr. Sam, and thank you to us and thanks for our viewers. So they will get some benefit from this, and we'll share the remaining details in the description as well. So thank you, Dr. Sam. Thank you very much for your time and your knowledge.
Thank you so much, Doctor. Thank you so much. Actually, my way of speaking is not that much good, not that much fluent, but what I remember, I had explained it in a very brief way. Actually, this kind of system, like traditional way of system, it's not like what we can explain in briefly way. It's very vast subject. So nice to meet you, and thank you.
Thank you, sir.